So hello everyone, today we are going to revise Portocaval anastomosis and have some word about Caput medusa. So first of all, what are Portocaval anastomosis? These are connections between the tributaries of portal vein and systemic veins permitting collateral circulation. So to understand in simple words, in this diagram, this is the vein coming from the spleen, so it is called splenic vein. From here the blood flow is coming from the intestine, so this is superior mesenteric vein, and these two join behind the pancreas and forms the portal vein, and this portal veins enters the liver. So porto and systemic, so portal part comes from the portal vein. We have seen how the portal vein forms, and the systemic part comes from inferior vena cava, so also called as portocaval anastomosis. So what are the major sites of portocaval anastomosis? We have esophagus, where left gastric vein and azygous vein forms the anastomosis. Near the umbilicus, the paraumbilical veins along with the superficial epigastric veins form the connections behind the rectum, in the retroperitoneum and bare area of liver. Let's see a diagram. So in this diagram, first of all, here there are the tributaries of the azygous vein and also portal vein, and at the lower end of esophagus there are some portosystemic anastomosis formed. Then at the rectum, the superior rectal vein forms the systemic part, and inferior rectal and middle rectal vein forms the portal part. Also superficial veins on abdominal wall near the umbilicus, paraumbilical vein accompany the ligamentum teres. So these are some major sites where the portocaval anastomosis are seen. At the bare area of liver, portal and phrenic veins form the anastomosis, and in retroperitoneum, colic veins and lumbar veins. So what is Caput medusa? So as you can see in the image, this is the umbilicus, and you can see these tortuous dilated veins radiating from the umbilicus, looking like this Greek character Medusa. You can see the hairs are radiating from the head and are tortuous. So because of this resemblance, this clinical finding is called as Caput medusa. These are dilated tortuous veins around umbilicus caused by recanalized paraumbilical veins. This is a sign of chronic portal hypertension. So what happens in portal hypertension? Let's understand with a diagram. So this is our liver. Here we have stomach. This is the small intestine. Now we are drawing large intestine. Here is our rectum. So from here, splenic vein comes. From below, superior mesenteric vein comes and forms the portal vein. If there is any kind of obstruction in the portal vein, so what will happen? Blood will not be able to flow forward, so there will be increase of pressure in backward direction, and for this blood to return back to the heart, it goes from portal circulation to systemic circulation via portocaval anastomosis. So this is the clinical significance of the portocaval anastomosis. So because there the pressure is increased in the portal circulation, This manifests as dilated tortuous veins at umbilicus, forming caput medusa. It may also be seen as hemorrhoids because of the rectal anastomosis. We have studied the superior rectal and middle and inferior rectal veins form the portocaval anastomosis at rectum, and also the esophageal varices. So esophageal varices manifest with hematomesis, that is blood and vomitus. Hemorrhoids, they manifest as bleeding per rectum, that is fresh blood from rectum. So now I hope you have understand what are portocaval anastomosis. Portocaval anastomosis. You should remember the major sites along with their clinical significance, that is esophageal varices, hemorrhoids, and caput medusa, which is a very important sign of chronic liver disease. So keep studying. All the best to all.